It is my pleasure to tell you a little bit about our speaker today, whose voice you heard just prior to the hour. Dr. Lorne Bigley is board certified in family medicine with nearly 20 years of experience. He has been providing patient-centered care at PeaceHealth in Eugene since 2008. He is an expert in electronic medical record systems and has often traveled to other PeaceHealth communities to share his expertise. Lorne is an avid photographer and a die-hard fan of the Oregon Ducks, and I'm sure many of the others on the line might share that same team loyalty. Our topic is of interest to Dr. Bigley, and I think you'll enjoy his stories and personal insights about exercise. Dr. Bigley, take it away.
Thank you, Chris. Yeah, I'm down here in Eugene, so when in Rome, you sort of root for the home team, and I've been down here for the last 16 years and have really enjoyed the Ducks and their run in football as well as other sports. I wanted to just share a little bit about why I'm interested in exercise and sort of my journey with exercise. I grew up in Ohio, in northern Ohio, in the Cleveland suburbs, and my experience with exercise was mostly as a Cleveland Indians fan and a Cleveland Browns fan, but I wasn't really a participant in high school sports. I played tennis a little bit, but really not much. When I went into medical school and in residency, I tried jogging a little bit, but could never really get more than a mile and kind of gave it up a lot. There was never really much into all this stuff because I really spent most of my time studying. When I was growing up, I was mostly into music. I played trumpet, and I was into drama, so I did the acting thing. But as you know, most people in band and drama are not really the most athletic people in the world. So I really wasn't much of an exerciser until I turned 30. When I turned 30, my daughter was born, Rachel, and all of a sudden something kicked inside me where I felt I had to do something to try to keep up with her. And then my son, Zach, was born a couple years later, and now I had 2 kids I had to keep up with. And I felt that since I was a father a little bit later in life than some others were, that I wanted to make sure that I was in shape and fit as they grew up and as my grandkids, which have not come yet, hopefully, thank God, that when they come, I'll be fit for them too. So some of the pictures you're seeing, all these pictures you're seeing here are pictures that I've taken. The one on the left is at the Oregon coast at Yachats. It's a place where people like to walk on the beach. The next one's at Kentucky Falls. This is a beautiful spot on the way to the Oregon coast between here and Florence. The third picture I took at Sun River, and this is of the Milky Way. And people who go to Sun River like to ski, cross-country ski, bicycle, a lot of outdoor activities. And the last picture is on top of Olali Mountain in the Cascades, just about an hour east of where I am, looking out to the Sisters. So what I'm going to talk about today is I'm going to give you lots of reasons why you should exercise. We've counted at least 20, and probably there are a lot more that I didn't even get into. All of the reasons that I'm going to be discussing are reasons I got from the primary literature, which means I did a literature search and looked up the actual studies that looked at the reasons why exercise was actually important and what the specific benefits were for exercise for those specific conditions. In some cases I'll be citing statistics, other cases I'll just be giving you an overview. We're going to talk about types of exercise. I'm going to give you some strategies on how to start and also some strategies on how to stay with the exercise. And lastly, we'll have a Q&A, so think of your questions and you'll be typing them in the chat window. So as Chris said, we're going to have some time for polls, and first I just want to see a little bit more of who is out there. So the first poll is, how often do you exercise? Seldom if ever, 1 to 2 times a month, 1 to 2 times a week, 3 to 6 times a week, or every day. So go ahead and click the one that most typifies how your exercise is. And I'll give you a few seconds to do that. Personally, I try to get to 6 to 7 days a week. And I should say that, I told you I gave you sort of my story about my exercise. Currently, my exercise of choice is I play tennis 1 to 2 times a week. I walk my dog pretty much every day, and I ride my bicycle to work. And recently, I got into stand-up paddleboarding, which I'm trying to do at least weekly here in Eugene.
So Dr. Bigley, it appears as if we have over 90% of our vote in, so I'm going to
Okay, let's
go
go
ahead and
ahead.
close this poll out.
Okay, let's see how that looks. And the answer to our survey is, so we have 10% seldom, 16% a couple times a month, 34% are doing it 1 to 2 times a week, 31% 3 to 6 a week, and 10% are doing it every day. So we have quite the range. So those of you who are doing it every day, congratulations, you're doing a great job. 3 to 6 times a week, doing pretty good. I think that's, anybody's doing 3 to 6 times a week, you're doing pretty darn good. We'll see if we can get you motivated to do a little bit more. And those of you on the upper part of the scale, we're going to see if we can move you down that scale by the end of this talk. Okay, let's go on. So whenever I talk to patients about how to, whether they should exercise or not, I hear a lot of excuses. This slide used to be, oh, there it is. Oh, here's the animation. It's coming in a little bit slower than it used to come in. Anyway, past failures, too cold, too painful, can't find a place to do it, no time, hate to sweat, other duties, boring, too tired, too wet. You know, here we are in the Pacific Northwest. Yes, it's going to be wet. There's a lot of reasons to do it, and for every reason that we have, I'm sure you could find a reason why that really isn't a very good reason. So what we're going to do is we're going to talk about reasons to exercise now. So we'll go on to the next slide. Here it is, 20 reasons to exercise, and here's a lovely young lady on, looks like she's in a spin class, perhaps. Okay? So, reasons to exercise. First, a lot of people talk about they want to exercise to lose weight. I want to tell you a little bit about that, though. It doesn't work as well as people like to say. There was a study that looked at weight loss, and in a 3-month period, people lost an average of 2 to 35 pounds. In women, exercise alone, if you don't change your diet, you're probably not going to lose much weight. Unfortunately for women, men are just the opposite. In fact, men can exercise and lose weight a little bit easier, and it may have something to do with testosterone. I don't really understand exactly why. But if your goal is to lose weight, you can't just exercise. You have to have the diet as part of that whole program. So number 2 and 3, decrease bad cholesterol and increase good cholesterol. So the bad cholesterol is the LDL. That stands for low density lipoprotein. I think of the L as for lousy. So exercising does decrease that LDL. You'd like to see that LDL under 100 if possible. And I usually can tell if someone exercises that LDL is much higher than it should be. And also increases the good cholesterol, which is the high density lipoprotein. The H stands for high, but I always think of the H as happy. So the happy cholesterol goes up. When someone exercises, almost always that HDL cholesterol is over 50 and frequently even higher than that. And if your HDL is in the 20s or even in the 30s, good chances are you're not exercising or you're not exercising well enough. It does improve blood pressure. One study looked at blood pressure and exercise, and it found that exercising lowers the systolic blood pressure, which is the top number, on average about 5 points, which is about the same as what a single medication can do for your blood pressure also on average. So of course I'd rather my patients be exercising than taking medications because there's fewer side effects with that. So here's a cartoon. The guy saying yes, yes, yes. Now seriously, what can we do to improve our health? And the doctor points to a sign that says exercise, 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 exercise. And there's a TV in the corner that says news, exercise is the key. We hear this all the time. So I'm just going to keep telling you why it's good. So managing health problems. So heart disease, as I said, if you can increase your happy cholesterol and decrease your lousy cholesterol, then you'll have fewer heart attacks. Also, people who have had a heart attack and they exercise have fewer subsequent heart attacks. And something that cardiologists frequently will get their patient into is what's called cardiac rehab, where you have supervised exercise. In diabetes, a study looked at diabetes and found that many of the parameters, including the HDL, LDL, but also the sugar control, is drastically reduced with exercise. I see this all day long. Patients who sometimes check their sugars quite a bit will tell me that if their sugar is high, rather than taking more medication, they go out and exercise for an hour, they check their sugar and a couple hours later, and it's always significantly lower. Depression. There was a meta-analysis that looked at, it was a meta-analysis, by the way, is a study of several different trials. There were 23 trials in this study that looked at over almost 1,000 patients. And they found that exercise had a moderate to large benefit compared to placebo or no treatment at all. And when you compared exercise to medication for depression, they found that there was no difference. Again, which tells me if you have a choice of medication or exercise, exercise is much better to manage your depression because there are fewer side effects. In cancer, there was a program called Activity Through Motion, which showed that there was a decrease in fatigue and increase in the quality of life compared to no intervention. And also, if you're trying to prevent cancer, exercise has been proven to reduce colon cancer, breast cancer, prostate cancer, and rectal cancers. Arthritis. In a study with rheumatoid arthritis, they found that exercise reduces inflammation, which is the key component of rheumatoid arthritis. And COPD, otherwise known as emphysema or chronic bronchitis, they looked at patients who have severe lung disease, and they put them through an exercise program. And this is called pulmonary rehabilitation. This is something that is pretty much standard of care these days because this is so well known. But in this particular study, they looked at people who either went to pulmonary rehab or even just were told to exercise and actually did exercise out in the community. And they found there really wasn't any difference. And people were able to prove that their lung capacity improved and their ability to walk farther also improved with COPD. Number 6, boosts your mood. Yes, it does. It increases the feel-good hormones in your brain, and that has been shown over and over in studies. Improve energy and fatigue. Many studies also demonstrate this, and there were so many I couldn't even choose one to go into that. Other reasons to exercise. Improve your sleep. Exercise makes you sleep quicker, and it deepens your sleep. Improves your sex life. In women, they have more energy. Women feel better about their body, and this increases arousal. And for men, it decreases the incidence of erectile dysfunction. And I believe the reason why the erectile dysfunction is improved has to do all with that HDL and the LDL, because a lot of times the reason for erectile dysfunction is a problem with the artery that goes to the penis. Promotes fun. Exercising is a lot of fun when you're exercising with friends and family. Doing things in groups like playing softball, playing tennis, aerobics, yoga, exercise classes of all sorts. It's a good way to build up relationships and learn and meet other people who are also equally active. So now we have another poll which is sort of relating to the next subject. So which of the following do not increase brain cells? Exercising, eating blueberries, drinking more than 5 drinks, eating dark chocolate, or none of the above. So I'll go ahead and give you a few minutes, or about a minute to answer that. Now I'll give you a hint. Exercising does increase brain cells. We do know that. So I'm going to give you a clue on that. And you could try to figure out if any of these other ones are not increasing brain cells. So how are we doing there, Chris?
Looks like we have about 80+% of our vote in.
Let's give it another few seconds.
That sounds good.
I don't know if anybody else could see this. Looks like we have 101 attendees now. That's pretty cool.
Yeah, and while we're waiting for the remainder of the vote, Tina asks a question about your previous slide and point on depression. She asks if there are any studies about exercise that you're already on medication. So any studies about exercise if you're already on medication?
There probably are. I don't know of those off the top of my head. That's a very good question, though. I could tell you anecdotally, just with my patients, that my patients who do exercise and are depressed actually do feel better. And I see some patients coming in who are not exercising and they're feeling terrible. We start them on medication. They start feeling better. Then they start exercise and they start feeling even better. And I think it's just an additive effect. So how does our poll look? Looks like we have enough to.
We do. We have 96% of the vote.
Oh, you guys are so smart. Yes, yes, yes. Alcohol does not increase your brain cells. Alcohol actually causes brain cells to die. So anyway, someone was a smart aleck, 'cause I gave the answer exercising, and someone still answered that. We'll have to get after that person. Anyway, so why do I bring this up? I think this is a really interesting study. I actually heard a TED talk about this, and it got me thinking a little bit more about it. When I was in medical school, we were told that we're born with the number of neurons that we're going to have the rest of our lives. But what they're actually finding now is that people can increase the number of neurons in our brain, and by increasing the number of neurons in the brain, we've been able to show that there's a reduction in Parkinson's, which is related to degeneration of the nerves, as well as decreasing cognitive decline, which is number 11, decreasing cognitive decline. There is something that I've been telling patients, and I've heard for many years, that in order to reduce your decline in your memory as people get older, having those senior moments, as they say, we should do crossword puzzles, read mysteries, do jigsaw puzzles, try to exercise our brain. Well, unfortunately, the recent studies do not bear that out to be true. However, the good news and the shining star is that exercise does improve your memory and reduces cognitive decline. Now, is exercise going to completely stave off Alzheimer's, dementia? No. But if you exercise, the decline that happens as we get older it gets less. So that's a good thing. Boosts brain power. So let's see. This kind of goes right along with that whole increasing of the nerve cells in our brain. And I should say, dark chocolate does increase, blueberries does increase in that poll, as well as eating vegetables and even having sex. All of these things have been shown to boost our number of cells in our brain. Also boost creativity. There was a study that looked at people who were given a task that required creativity. Then they were told to go out and exercise. Then they came back and they tested them again about doing another creative task. And they found that there was a boost in creativity that lasted about 2 hours after you exercise. And in fact, when I was preparing for this talk, I started thinking of other things that I could do with this talk right after I exercised. So I know that that's true just from my own personal experience. Other reasons for exercise: improve self-esteem. There was a study of over 250 people that looked at this particular issue. They divided the people up into young men, young women, older men, and older women. And of those 4 groups, all but the younger women actually did have improved self-esteem just with exercise. They also found that the reason why you exercise also has a direct correlation with self-esteem. If you're exercising to increase your health and improve your fitness, then you'll have improved self-esteem. If you're exercising to control your weight or to improve your tone, it doesn't necessarily improve your self-esteem. Promotes productivity. Studies show that those who exercise are more productive than sedentary peers. This is probably why many employers now are giving Fitbits out to their employees or doing other types of programs to encourage physical fitness. And reduces addiction. Exercising increases the dopamine in the brain, which is one of the neurotransmitters, the chemicals that make the nerves do their jobs, that is depleted when someone is on chronic narcotics or opioids, such as oxycodone or OxyContin, for example. And they found that those who have problems with addiction and then they start exercising, they have fewer relapses. So exercise is an important part of treating addiction. Rounding up the top 20 here, reasons to exercise: reduces frailty in old age. Now, I don't really know of any study other than reducing heart attacks that really say that exercise makes you live longer. But what it does do is it makes those later years of life much more vibrant. And as you get older, if you don't exercise, you become more and more frail, more likely to have other significant problems. There's a story, this is a true story. I was at the gym doing some exercises, and there was a 92-year-old who was working with a personal trainer. And I remember this guy really well. He was pushing on this weights machine with his legs, kind of working on his quadriceps muscles, which are the top muscles in the thigh. And I asked this trainer, how's he doing? Is he able to actually increase his strength? And in the last 3 months, the 3 months prior, he had significantly increased his muscle strength just by working out with the trainer. And I thought that was remarkable at age 92. So you're never too old to start. Increases bone density. Bone mineral density has been shown to be improved, and this is the factor involved with osteoporosis. If you're doing weight-bearing exercises like walking, running, things like that, it will increase it. Now, if you're swimming, that doesn't increase your bone density. So it has to be something that you're bearing weight on. Reduces falls. There's a type of exercise called Tai Chi, and there'll be pictures of it later on. But basically, an exercise, a study showed that it reduces falls in 65 years and older, patients who are 65 and over. And it also improved degenerative joint disease, Tai Chi did, in knees. This is osteoarthritis. Frequently, the physician will tell people who are having falls that they need to have physical therapy. But mostly what physical therapy is doing is just increasing your muscle strength. There are also fall-specific programs that people can do that involve exercise. And lastly, modeling it for others. Here's a picture of the kids working on the jungle gym. I think that's what they're doing. Anyway, we want to model it for our younger generation because if kids see that you're exercising, they'll want to exercise too. So why do we believe the latest, so here's a little cartoon. Why do we believe the latest report that says exercising slows down the aging process? And the guy who's jogging with him says, oh, I'm 147 years old. Okay. So when you're weighing the excuses versus exercise, which should you do? Let's see what the scale says. Oh, looks like exercise is the winner. Was there any surprise? There's a little pause after this slide. Here it goes. Okay, so now we're going to talk about types of exercise. Four different basic classes of exercise that are depicted in these pictures. There's aerobic, resistance, which is like the weights, balance, which is like Tai Chi, and flexibility, like yoga. So I want to do a quick poll. So type in the chat window, what type of exercise is your favorite exercise to do? If you're not doing exercise, what type of exercise would you like to be doing? So we'll give you a few seconds to figure that out and type that out in the chat window. As I was saying before, my personal favorite, yeah?
While we're waiting for the responses, we have a question from Jack who asked, Jack has inflammatory arthritis and said Pokemon Go has gotten him up and out.
Yes. I think Pokemon Go has been pretty remarkable. I was riding my bicycle through the park the other day, and I saw these teenagers walking through the park with looking at their iPhones, and as I was passing my bicycle, I was, find any Pokemon? They go, yeah. It was kind of funny. But yeah, anything you do to get out is awesome. So I wonder if Jack's arthritis is doing better since he started Pokemon Go.
Jack types yes.
Awesome.
So in addition to Pokemon Go, we also have some other examples kind of trickling in here. We have strength training, kayaking, gardening, walking, running, Pilates, swimming, and yoga.
Excellent. Okay. Let's move on to the next slide. So a lot of those things were mentioned here already. So I just want to point out a few other types of exercises you could consider. Resistance training. It has bands here, but also any kind of resistance training using machines, total gym is one you can put in your house, for example, or there's so many other these types of exercise machines. Isometrics, where you push your muscle against immobile objects to strengthen specific muscle groups. Swimming, water aerobics. I've recently gotten into paddling. Stand-up paddleboard I'm doing now, but kayaking, like someone mentioned. Dancing. This is something that a lot of my, I have several seniors in my practice who just, I ask what they do for exercise, they go dancing 3 or 4 times a week. And they just love it because it's social, it gets their heart rate going. Gardening, housework, and in the much, much more category, I think of all the exercise machines that you can get. You can get a treadmill or a exercise bike or an elliptical machine or any number of machines. So the doctor says to the patient, that's not what I meant when I suggested you get an exercise machine. And you see behind him he has a robot that's lifting weights for him. Not exactly what I mean. So how do we start? First, you have to decide to do it. You just look at the benefits, decide if these benefits are speaking to you at all, and then resolve to just get it done. Then figure out some goals you want to do. I do not recommend that you use weight loss as a goal, although it's something that's easy to measure. You just step on the scale. But think more like you want to be able to walk that half marathon or jog that or run that 10K or ride a bicycle in the park with your grandchildren. Things like that. Set a goal that's achievable. And it's good to have small goals that get you up towards a larger goal. Make a plan. Try to build variety in your exercise program. And I love this cartoon. I think this is perfect. The husband says to the wife, I did a 30-minute workout today. 15 minutes looking for my sneakers, 10 minutes looking for my sweatpants, and 5 minutes on the treadmill. Now, you may think of that as a fail. I think of it as a complete success. When you start your exercise program, the first step is getting prepared for the exercise. And this guy did an excellent job in preparing himself. Tomorrow, you'll have his sneakers and his sweatpants all ready for him, and he'll be able to spend more of his time on the treadmill. Step 4, prepare for success. Someone's going to have a Fitbit today. That's a device that can be really motivating. I have my Fitbit on, and I work on exercising, trying to get to the 10,000 steps every day. I get to it most of the days. And it's amazing how motivating this silly Fitbit thing is. If I have 9,000 steps by the end of the day and I'm at home and I'm not going to be planning an exercise, I will walk around the house for 1,000 steps to get that 10,000 steps. I just want to make sure I get there. There are apps that are really useful. There's one app called MyFitnessPal, and it's just one of many apps. You could go on your App Store or your Play Store and you could find apps. But MyFitnessPal, as an example, has a couple different modes. One is the exercise mode, where you log in your exercise and you have a friend or a partner or maybe even a community of people who are all signed in on the app, and you could see what everybody's doing. When you see that someone has already exercised 30 minutes and you're deciding whether you want to do your exercise or not, to me, that's pretty motivating. And the other part of that app, by the way, is basically a food diary. You could chart all the food that you eat, and it's very easy to do. And of course, get the right gear. Make sure you're prepared. You live in the Pacific Northwest, and it does rain most of the time. So if you have the right gear, as REI likes to say, there's no such thing as bad weather, just bad gear. Build accountability. This is the way to really where the rubber hits the road. Make a bet. Now there's a couple ways of doing this. One, you could have a partner and you could say, in 3 months, you and I are going to run the, here in Eugene we have on the 4th of July the Butte to Butte. It's a 10K run. So you can make a bet that I will finish the 10K faster than you, and then that's a straight bet. But even better, you could do a bet with yourself where you take a certain amount of money and you give it to your partner or a friend or somebody close to you and say, in 3 months, if I'm not still exercising, or some period of time, whatever you decide, I want you to donate this money to a charity that I do not like. If you know that in 3 months that money is going to be going to a political party, for example, that you don't agree with, oh man, is that a good motivator? That would motivate a lot of people, I think. Another good motivator is getting a partner. A dog counts. My dog Toby loves walking with me every morning. When I don't go for a walk, if I have a 7 o'clock meeting and I'm not going to walk that morning, he lets me know about it. But I had a neighbor who lived across the street from me, and he and I ran 3 or 4 days a week. And we did that for several years. And if I wasn't feeling that great, I still got up because I didn't want to let him down. And lastly, join a class or a team. That's a very good way to be accountable because they're counting on you to be there. Now, if you have health issues, and I know some of you do, in fact, as I was hearing about, as people were coming on, I noticed there were several of my patients up there, and I want to give a shout out to all of you who are my patients. I'm glad to see you here. But if you do have some health issues or problems, make sure you talk to your doc first before you start an exercise program. And the health issues I'm thinking about specifically are heart problems. If you're having chest pain that's not really diagnosed well, and you're not sure if it's your heart or if it's just something else, make sure you have that diagnosed, because if you're starting to have a little bit of chest tightness or chest pressure or pain and you go on exercise, you're putting more work on your heart, and that could actually lead to a heart attack. So just make sure you know that you're okay to do this. When you start off exercising, start off slowly. I recommend, if you're somebody who doesn't exercise, if you're very sedentary, set your goal to do just 10 minutes a day. If 10 minutes is too much, make it 2 minutes. The idea is that you're getting yourself in that mode to exercise. You're getting your gear on. You're getting your shoes, your sweatpants, whatever you need. You're getting your bathing suit on if you're going to be going swimming. Whatever it is, do it the same time every single day. Make it part of your schedule. You don't forget to eat lunch, usually. This way you won't forget to exercise. It's just part of what you do. Do that every day for 3 weeks. Once you've done something every day for 3 weeks, the psychologists say that it's human nature that it becomes a habit. And once it becomes a habit, it's really hard to stop. Make sure you stop. You start easily. Pay attention to what's going on with your body. If you're feeling dizzy or having some shortness of breath, make sure you stop or slow down.
Dr. Bigley, I want to pause for just a moment to answer some of the questions that are being transmitted.
Okay.
We have a question from Donna who asks, can you discuss exercises for sore shoulder or rotator cuff?
I think that's a little bit beyond the scope of this, because that's something that you'd have to either, there are some very specific exercises that can be done for specific conditions like rotator cuff or hip bursitis or what have you, but it's too specific, I think, for this topic. You probably should talk to your provider or your physical therapist to bring that for you.
And this question from Kate, what do you think about the value of interval training or high-intensity interval training, HIIT?
Yes, they say the high interval training is one of the most aerobic things you could do, the best things you could do for your heart. I personally don't do it, but it doesn't mean it's not great. I think people who do it have some significant benefits they're finding with their cardiovascular fitness. It's an excellent way of training. It's a lot of work. And for those who don't know about this, my understanding is that you walk a certain distance, then you sprint, going all out for 100, 200, 300 yards, some distance, and then you stop and walk again, get your heart rate down, wait for a minute, then you go off and sprint again. I think that's my understanding of the interval training, and it's pretty intense.
And the final question at this moment from Emily, one that I can personally relate to. Do you have any tips for waking up and getting going in the morning? It's hard to get over the grogginess.
Yeah, it's just a matter of doing it every day. Like I said, setting making your time the same time every day. I could tell you personally, my alarm clock wakes me up at 5:15 every morning, except my days off. And in those days, it's just whenever I wake up, and then I go off and exercise whenever I wake up. But on days that I'm working, I'm up at 5:15, and I was never waking up at 5:15 before I started exercising regularly. But I found with my busy family, those early morning times were kind of golden because there wasn't anybody else competing for my attention. So it's just a matter of setting that clock. It's just like changing time zones, basically. You just wake up a little bit earlier, set the clock, and go for it.
Excellent. Well, thanks to everyone for their questions, and we'll move on.
Okay, so working towards fitness. As I said, once it's a habit, after the 3 weeks is up, then you can start increasing the time. After 3 weeks, you may find 10 minutes is way too easy. In fact, even before then, you may find 10 minutes is too easy. There's nothing that's going to stop you from going ahead and increasing that to 20, 25, or 30. And then exercise as much as you're able to. But if you get to 30 minutes most days out of the week, you're doing pretty well. Just work towards preventing injuries, and that helps. It helps to change up your exercises, and that's the variation, and cross-training are other words for that. Don't just do the same thing all the time. I know some people who only run. They have awesome leg strength and lower body strength, but their arm strength there's nothing there. So if they do something like washing windows or doing something that involves using their upper body, they get sore and it's harder for them. So if you add the variation to your exercise, then you really are able to do a lot more in your life. So how do you know that you're there? So we'll be getting into a little math here, so don't freak out. This is really easy. So you could calculate what your maximum pulse rate is by taking 220, subtract your age. The target goal is 60 to 70% of that number. So the next slide will give you an example of how that math works. So let's take a hypothetical 50-year-old because the math is easy with this. You take 220 minus 50, so that's 170 beats per minute. The normal 50-year-old person cannot exercise to get their heart rate faster than 170 beats per minute. Your target heart rate should be between 60 and 70% of that maximum. So in that 50-year-old hypothetical person, you get your heart rate between 102 and 119. That's a pretty good target heart rate. And you can shoot for anywhere in that spot. So how can you tell that you're fit? During exercise, what you could do is right at the end of your exercise, you could touch your carotid artery or your radial artery. The carotid artery is right by the voice box, and the radial artery is near the base of the thumb on the wrist. And you measure your pulse. If your pulse drops 15 to 25 beats after 2 minutes of rest, then you're called, say that you have a good aerobic capacity. Your heart is really doing well. If your heart rate takes longer to drop, for example, at the 2-minute time period, if it's only 12 beats per minute less than it was at peak exercise or less, then you have more work to do and you're not physically fit. And how do you check your pulse? This is easy. You just count how many beats you get in 6 seconds and multiply by 10. If you want a little bit more accuracy, you could take how many beats you get in 10 seconds and multiply by 6. Or you can count 15 seconds, multiply by 4. You get the picture. Another way to tell if you're fit is go to a track or go a known specified space of 1 mile in a flat area and see if you could walk that 1 mile in 14 minutes. If you could walk a mile in 14 minutes, then that's considered also to be physically fit. So how do you stay with it? Now that you're getting going on it, you want to stay with it. Here's some guys doing their jogging together. That's a good way of doing it, just having partners. First, just look at yourself. You notice the difference. I know when I exercise, I'm able to bound up steps easier, and I like that feeling. So notice the changes in your body and the changes in your fitness. And if you find that some things work, stay with it. If you find it doesn't work, don't keep pushing yourself to do that same thing that doesn't work for you. Change it up. Share your successes with your family and reward yourself. Unfortunately, many of us Americans reward ourselves with that double chocolate muffin at Starbucks. Don't go down there, okay? Reward yourself with things like a vacation or a weekend getaway or something like that. Or maybe some other type of thing that you can reward yourself that's not food related, because that's a little counterproductive. So what would keep you motivated? Let's open that up to the chat window also. So go ahead and type things that would make you motivated to stay with the exercise program. I'm interested to see this because when I put these things up, these are just things that motivate me, but I imagine there are things that motivate people that are different.
And Dr. Bigley, maybe as the responses are taking place, we have a question from Heidi about the benefits of water aerobics.
Yes, water aerobics. Water aerobics, it's excellent. It doesn't increase your bone density, as I said, because basically it takes the weight picture out of it. But water aerobics are outstanding for people who are overweight, so overweight that makes it difficult for them to walk, or people who have significant lower extremity arthritis, like degenerative joint disease of the knee, because it just takes that weight off. And there are some people who are just amazingly fit with water aerobics. And I think it's a marvelous form of exercise. How are we doing with how are we doing with the chat?
I think that this one's soliciting more chatty responses. So let's give it a moment for those responses to be captured. Randy asked, can exercise raise low blood pressure or hypotension?
Well, exercise temporarily raises your blood pressure. We know that. I used to do exercise treadmill testing in my practice. So in exercise treadmill testing, people walk on a treadmill and you measure your blood pressure every 3 minutes. And everybody will have an increase in their blood pressure as you're exercising. But for a chronic long-term when you're not exercising, I'm not sure about that. I don't know if it raises your blood pressure. Perhaps maybe some weight training. There might be other people who might know this answer better than I, but I don't know that answer.
Excellent. Well, we do have some of our specific answers to what keeps you motivated.
Okay.
Some of the more popular responses are weight loss, more energy, feeling better, change in waistline, stronger, better endurance, something you mentioned earlier, Dr. Bigley, active with my kids, going to the beach, although I have a feeling that might be the beautiful weather we're having inspiring that. Another one, weight expressed differently, and lower blood sugar, as you mentioned before too.
Great.
Do you care to elaborate on any of those, or?
No, I think they're pretty self-explanatory. Yeah, I think that's awesome. So let's go on to the next slide. So this is, if you remember nothing else about this talk, this is the one take-home message I'd like for you to have. If you don't exercise today, what one thing are you going to do today on July 28th, Thursday? What are you going to do today to make that first step to start the exercise program? Or if you're listening to this on tape afterwards, then what are you going to do today on whatever day you're listening? That first step is always the hardest. If you don't have good shoes, then a good first step would be just getting good shoes. If it's in the wintertime and it's rainy and you don't have a good raincoat, get a raincoat. If you have all the gear, I have patients say, you know what, I'm going to go home and talk to my wife and we're just going to go out for a walk today. She's always been bothering me to walk anyway, so I'm going to do that today. So do that one thing today, and once you get that first step over with, the second step is a lot easier. I always like to say, the longest journeys always start with a trip to the bathroom, but then after that, the first step. So this is the first step. So with that, we'll open up to more questions. So how are we doing there, Chris? Anybody have any other questions?
So, hi everyone, this is Lisa. I'm stepping in temporarily. Chris's headset seems to have gone dead.
Oh no.
So while he, sorry about that. I think while he tries dialing back in, I'll ask some questions that I know have come in so Dr. Bigley can elucidate. So Deb asked, how much cardio per week versus strength exercise is recommended to reduce cholesterol?
To reduce cholesterol specifically, there really isn't a specific ratio or amount of exercise you should do. It's just something every day. But I do want to mention, this really brings up a great point. When you're doing resistance training or weight training, I've heard it said you need to give your muscles at least 1 or 2 days between times that you exercise those specific muscles. So some people like to do weight training every day, but they'll spend like Monday and Thursday working on the upper body, and they'll spend Tuesday and Friday working on the lower body. Themselves 2 days of rest before they work on those same muscles again. And muscles tend to improve or increase their strength if you exercise them strong, give them time to rest, then exercise them again. Aerobic exercise, you could do that the other days of the week, or you could do it every day if you choose. I don't think there's any real maximum amount of exercising with aerobics that you could do from a day-to-day basis. Now, given that, of course, you can over-exercise, and that's a whole different issue, but I'm not going to get into that today.
Okay, I think Chris is back. Chris?
Okay.
I am. Thank you. Sorry
Hey, Chris.
for the difficulty. Hi, Dr. Bigley. Our next question is from Wendy. How can we encourage our spouse to exercise?
Well, you can make a bet. Being the positive example, if you exercise yourself, then of course you can get your spouse to exercise. Rewards, things like that. There's actually a really interesting sociological study that I saw. They looked at communities of people, and they found that if your community in general is a community who tends to exercise more, then there is a much higher chance that you too will exercise. Now, I'm not saying you should disengage with your friends who are couch potatoes. However, if you're trying to get your husband to exercise more, it might be a good idea also to start associating with other people who exercise. Then it becomes more the social norm for that group.
Now this question from Patty has a bad balance. What can she do to make it better?
This is a real common problem I see in my practice. The best thing that we know to improve balance is Tai Chi. Depends on your community, but most communities, I know here in Eugene, for sure we have this, where a lot of the community centers will have Tai Chi for the elderly. If you are in a community that has that, it's very inexpensive to do this. I have not personally done that, but I've heard that it is something that's available and works very well. Again, it reduces falls also, we know that. So Tai Chi is far and away the best thing that I know of to improve balance. I could tell you personally that what I do to improve my balance, it sounds a little goofy, but you know, I'm always thinking of exercise because I think it's so important. When I brush my teeth, I stand on one leg for 2 minutes while I brush my teeth and have the other leg up in the air. When I first started doing this, I have one of those toothbrushes that vibrates and it beeps every 30 seconds. I used to only keep one leg up for about 30 seconds. Now, 2 minutes. I've just been able to increase that balance, and it's helping me when I'm putting my shoes on in the morning. I don't have to lean against the wall. I could just stand on one leg and put my shoe on. So yeah, that's just another way of increasing your balance.
And Dr. Bigley, we've had a few comments come in just kind of asking about hydration and how that fits into one's exercise program.
Yeah. Well, it obviously depends on the weather. It's going up to 92 here in Eugene today, and if you're going to be out exercising, absolutely make sure that you have water. I think of, what is it, Gatorade or something like that. You think of obey your thirst. You know, uh, it is important to listen to your thirst. However, I do know also that as we get older, our thirst mechanism tends not to work as well. So some people just don't feel thirsty, but then they get lightheaded and could even pass out if they're working out too hard, especially in the heat. So it's always a good idea to make sure you maintain hydration, because as you're exercising, as you're sweating, you're losing all that water. You've got to replenish it. Just as an example, by the way, yesterday I rode my bicycle for about an hour. It was like in the mid-80s. When I came home, I weighed myself, and I was 2 pounds down from what I was in the morning, just from riding my bicycle and perspiring rather. So I should have been drinking more, and I did. I had a whole water bottle. I drank half of that water bottle by the time I got home. It still wasn't enough. I had gotten quite a bit drier than I wanted to.
Excellent. This question comes in from Molly. Molly asks, how much time per session or time per day should you exercise? And I think there's a fat loss kind of implication there.
You know, the literature is kind of vague on this. It really depends on what study you look at and what your goals are. Most of the time I'm seeing people talk about 30 to 60 minutes a day. If you can only get 20 minutes, well, 20 minutes is better than nothing. I have also seen that you could do, if you wanted to do 30 minutes, but you can only get in 15-minute sessions, that works equally as well. You could exercise 10 minutes 3 times a day, and you can get your 30 minutes in that way too. So I like to shoot for at least 30 minutes, you know, and since I'm a overachiever, I guess, in some ways, I shoot personally for an hour. But that's just where I've come to after all these years now. You know, my daughter's 23 now, and I've been exercising pretty much since she was born, or before she was born, and I pretty much now am exercising, try to get an hour every day. So 30 to 60 minutes, I think, is a good goal.
Terrific. And Dr. Bigley, this is our speed round of Q&A in that we have 3 questions that we're going to close out with, and okay. Just a minute to answer each. So starting with Robin, who asked, what do you think about supplements like raspberry, ketones, and cider vinegar?
Don't know much about that specific supplement. I am this again, a little bit beyond the talk. I'm mostly looking at exercises, but just briefly, I feel strongly that we should eat a balanced diet, which includes 5 servings of fruit and vegetable every day, limiting the amount of red meat that you eat, eating just, you know, not too many carbs or breads, but some every day, and also having some fats in your diet every day. But other supplements, multiple vitamin you could eat, you could take that. Supplementing with vitamin D, especially here in the Northwest where we're not getting as much sunshine, I think is a good idea. But if you're talking about some of these other supplements that are bartered or sold, I'm not personally a big fan of those. I think if you just eat healthy, then you're getting most everything that you need. And that was 55 seconds. Okay.
Okay, fair enough. And from Heather, and this is a broad question, so we'll condense it down, but how do you start when you have trouble finding the time to exercise? Maybe your top 1 or 2 kind of creative ideas.
So I'm a family physician. And up until my kids left, they were very active in my house. We had lots of things going on, lots of competition for my time. I found the best way to do it is shoehorning it in someplace where there's some lead time. Personally, I found first thing in the morning was the best time to do it because that was a time that everybody was still asleep and it was a golden time. I started off with just a small amount, 5 minutes, 10 minutes. Once I was able to do 10 minutes, I increased that up to 12 minutes. Certainly I could do 2 more minutes. Then I bumped it up to 15. Certainly I could do 3 more minutes, and just sort of gradually increasing the amount of time. And it's amazing how much you can get in once you start off slowly and work your way into that. But I know some people, if you have 2 jobs and you're a single mom, it's just not going to happen very easily. So you have to get it in your schedule in different ways, like parking farther away from the entryways to the grocery store or work, or taking the stairs instead of the elevator, things like that.
I hope that helps, Heather. I struggle with the same challenge, so thank you, Dr. Bigley. And in 30 seconds, Dr. Bigley, from Carrie, she asked, does just walking reduce blood pressure and or blood sugar, or do you have to get into the aerobic level of exercise?
Well, it depends on how fast you're walking. If you're strolling, walking 1.5, 2 miles an hour, your heart rate's not going up, I don't think you're going to help your blood pressure an awful lot. I think you got to push it a little bit. But if you're walking at a decent clip, walking up hills, down hills, yes. The answer would be yes. Your blood pressure will come down, more likely than not.
All right, right within the 30 seconds. Great job, Dr. Bigley.
Thank you.
And that wraps up our question and answer session. Great questions, and we really appreciate everybody's participation.
Yes, and I just want to say one thing. Thank you so much for taking an hour out of your day to help yourself with try to get healthier, and hopefully you've learned a little bit with this talk.
Well, and our Fitbit winner is going to walk away with even more than just strategies, but a bright, shiny new Fitbit. And the winner, randomly drawn, is Debbie LeClaire. So Debbie, if you're listening, we will get in touch with you to figure out how to send this Fitbit device to you. And congratulations. So we've had a great time today sharing healthy knowledge with you, and a recording of today's webinar will be available in a couple of days on the Healthy You webpage, which is at peacehealth.org/healthy-u. Again, that's peacehealth.org/healthy-u. Finally, please take a moment to share your thoughts in our survey as you leave today's webinar. You'll automatically receive the survey when I conclude the session. So thank you again for your interest and engagement in today's Ditch the Excuses presentation. And remember, healthy is up to you, but Peace Health is always here to help. Thanks again, everybody, and have a great day.
Bye-bye.